Well, I think we should get started because this is a precious hour that we have with an esteemed group of panelists here. So want to welcome everyone this morning. We are extremely excited about today's webinar. I have to start by saying we are very grateful to the Secretary of Education, Dr. Miguel Cardona, and his team for being the energizing catalyst behind the gathering of such an esteemed panel this morning. Dr. Cardona's office reached out to us with an ask to communicate directly with you, our membership, the high school ecosystem, if you will. And today we are extremely privileged to hear from not only the Secretary, but also the American Medical Society of Sports Medicine, the Centers for Disease Control and Prevention, and along with them are our Superintendent of Schools from Fairfax County Public Schools, Dr. Scott, and representatives from the Anacostia Senior High School in Washington, D.C. The discussion this morning will be focused on COVID-19 vaccination for the 12 to 18-year age group and the importance of vaccination relative to returning to school and to co-curricular activities. Because the hour that we have together will go very quickly, we've established a format to be sure that we hear from each of our panelists while also addressing questions that reflect the interests of the audience on the call. Each of our leaders will offer remarks, and some questions have been submitted in advance that reflect the interests of our membership. If any of you on the call have questions or concerns, we encourage you to submit them in the chat, and we will compile a list of those questions for follow-up. We will not actually be entertaining those questions live because the hour will move very quickly. So on behalf of the NFHS, AMSSM, as co-hosts of this event, gratitude to the Secretary's Office, to the CDC, to the doctors that you'll hear from, to our peers from the public schools in the DC and Virginia areas. We are really thrilled to have this opportunity to engage with all of you. So we will move right away to our first guest this morning, and they are from the American Medical Society of Sports Medicine. We have Drs. Amy Powell and Dr. Jason Matusek. And Amy and Jason, please, we welcome you this morning.
Thanks, Karissa. Much appreciated. We appreciate the opportunity to be here. So I'll start and then turn over the floor to Jason. Dr. Amy Powell, that's me. I'm the president of the American Medical Society for Sports Medicine and a sports medicine physician at the University of Utah. AMSSM is an organization made up of 4,500 sports medicine physicians. We get to care for athletes and active people of all ages and abilities, from Pee-wee soccer players to professional and Olympic athletes. But today we're here to talk about interscholastic and youth sports. The health and safety of athletes is always our highest priority. COVID case numbers in school-age kids are increasing, and COVID vaccination rates in the eligible 12 to 18-year-old age group are still relatively low. Our more urgent concern as we move into the largely indoor winter sports season is that young athletes will get sick. COVID vaccines are safe and effective. And with that as a brief background, I'll turn it over to Dr. Jason Matusek.
Thank you, Amy. This is really, we're excited about this opportunity to speak with everybody today about how important and impactful we truly believe that vaccination against COVID really is for our athletes. And it actually extends out beyond the athlete population directly. It's not just our young athletes, but it's the circles around them. You know, we know that our young athletes disproportionately were affected by the pandemic last year in terms of the number of clusters of COVID that were associated with sports and athletics, and the amount of time missed from school due to being exposed to COVID through sports and athletic activities. So we do know that some of the exposures happen on the playing field, but we also know that a lot of the exposures to COVID happen around the activities associated with sports, whether it's traveling together to games or having team meals together or being in hotels and traveling together, just being on a bus and traveling across town to other schools to participate in sports and athletics. We know that all of these situations have led to outbreaks in our communities, and the outbreaks extend on beyond the playing playing field to the greater community, sometimes affecting dozens or hundreds or even thousands of other people's lives because of this. We know that vaccines are safe and effective for multiple medical conditions. Vaccine requirements already exist in I believe all 50 states in order for school entry. And we, as a society, feel so strongly about this that we have prepared a statement to say that, yes, we do believe that vaccination against COVID should be a requirement of playing interscholastic or youth sports. We feel that the number of outbreaks that occurred in the spring and winter last year were a drop in the bucket compared with what we could experience this fall and winter, especially with the much more contagious Delta variant that everybody is aware of. Just recently, even over the last month, some of the data coming out early on from North Carolina showing that about 45% of their clusters have been associated with sports, and I think 38 clusters in August alone. Parents see these disruptions to sports affecting their children, where they see that it impacts their health, their happiness, their sports and athletic development, their friendships, their emotional well-being. I mean, like, all of these things have been cited by parents as being impacted by the COVID pandemic. And we have an opportunity here to really reverse that trend by moving ahead with vaccination for our kids who are eligible. One of the things that we would like to see is that one of our concerns with vaccine requirements, as with any hurdle, is that it might disproportionately affect some of our individuals who especially have less access to health care. And anything that creates a barrier to participation always forces us to take a second look. However, we as a sports medicine society really stand ready to assist these communities who feel like they're being disproportionately impacted, to be able to help overcome the barriers in their communities and make sure that we're really working at the community level and getting our athletes vaccinated wherever possible. I think that there are some questions that have been raised that would be appropriate for us to address. One of them is the idea of whether or not any young athletes have died due to COVID or its complications. And the National Catastrophic Center for Sports, which tracks all of our youth sports across the country and looks for things like deaths, has been looking at this, and primarily through media accounts and things like that. They have identified less than a dozen, but almost in that range of young people who have died from COVID who are athletes. So these things do impact them. But more importantly than the deaths are the longer term health implications that come along with this, which we're still discovering. Upwards of 1 in 7 kids who have had a COVID infection have persistent symptoms that we've been describing as something called long COVID. And these things matter. Their time away from the classroom where they aren't learning, that matters. The impact to the other people, the school districts who have already had a number of teachers or coaches who have died due to COVID that started originally as an outbreak in the community because of things like these co-curricular activities. These impact people. So even though the deaths have remained fairly low in the athlete populations, the implications of the disease remain profound. One of the other questions that we'll oftentimes get as physicians is that, because we came out with a statement about 6 weeks ago or so that NFHS was a part of, where we talked about, doing vaccination against COVID at the pre-participation evaluation or at the sports physical. We looked at this as being a great opportunity where we're actively engaging our young people to say, hey, have you gotten vaccinated? If not, can we do it now? And one of the questions that often would come up is there an effect on physical performance, athletic performance from getting vaccinated? And the short answer is that if somebody is feeling the effects of their immune system working as it's designed to do by learning how to fight an infection by being vaccinated. Sometimes people can feel crummy for a day or so, and that certainly might impact their ability to be able to participate in sports that day. But we have not seen any of the long-lasting physical performance implications associated with vaccination. That these athletes are able to do it during the course of a season without missing time, that they're able to continue to participate without having those impacts in physical performance. And some of the data, frankly, shows that being active at the time of your vaccination may improve the vaccine uptake, might improve your immune response to being vaccinated. So this is an ideal time really to do it. And as Dr. Powell had mentioned, especially going into these fall and winter seasons, we have this concept of potentially, people talk about, well, maybe this is a lower risk sport, maybe it's a higher risk sport. What really determines that? Is it outdoor? Is it indoor? Are you competing individually? Are you competing in large groups? What's the situation? Well, locally, we've been in contact with our Department of Health in the county, and we find that probably the number one place that this has been spread in our area is in the locker rooms. And that, they're probably, all sports to some degree use a locker room, or most sports do. So when we talk about lower risk activities, I know that our colleagues over here at the CDC will be able to tell us a little bit more about that, but we don't look at them as being lower risk or higher risk sports. We take a look at all of our athletes being impacted by this equally, and we say that all of our athletes, youth, interscholastic, who are participating, especially in practices with other students and in competitions with other schools, really this is something that we feel strongly should be a requirement, and just like our other childhood immunizations, in order to be able to participate in sports. So with that, I think that I hit on all the points that we wanted to get to. Dr. Powell, did you have any last thoughts before we turned it back over to Karissa?
No, thanks. That was wonderful. Good job.
Back to you, Karissa.
Outstanding. Oh my goodness, that was outstanding. I think I was looking at the list of questions that we had from our membership perspective, and you just hit on every one of them that I had. Certainly we'll monitor the chat, but I can't thank you both enough for taking the time to be here. We certainly are going to work very closely with you always, as we have and want to continue to do. So we really appreciate your time with us today, and hope that you can stay on for the remainder of the meeting. At this point, I see that we have our Secretary of Education, Dr. Miguel Cardona. Dr. Cardona, we are extremely appreciative of you taking the time to be with us. And thank you to you and your office for being the catalyst to organize this event and bring these folks together around this very important issue. It's great to see you. So we want to certainly give you your due time here to offer your thoughts around the importance of vaccination and getting our kids back to school.
Definitely. Thank you very much. So glad to be here with you. Thank you, Karissa, and to the National Federation of High School Sports and the American Medical Society of Sports Medicine for having me today. I'm grateful to you for organizing this really, really important conversation. And to all the high school sports leaders here today, thank you for all the hard work put into making sure that the students have an opportunity to be on the field and to protect yourselves and your teams and your neighborhoods during this difficult past 18 months. These last 18 months have tested all of our leadership in ways we couldn't even imagine before. Many of you were pulled in so many different directions that it was hard to keep your head up. Thank you for always putting kids first, even though it was very tough at times. I come from Connecticut, and although you may not think of Connecticut as a sports powerhouse, we have ESPN and we have Karissa. So I've known Karissa for decades, and I'm thankful that she's leading NFHS. Connecticut's loss is our country's gain, and we're now fortunate to have a champion like Glenn Longarini in Connecticut. I think it's really important that I take a moment to thank my kids' athletic director, Bob McKee, in Connecticut, for doing everything possible to keep kids on the field. As a father, when they come home, my kids, the first thing they talk about is how their soccer practice went or how their volleyball practice went. My schedule as Secretary of Education will always have my kids' sport events on them, because That's how important it is, those events are to my whole family, not just me, but my wife and my entire family. I'll be on a flight in 2 hours, and I'll be on the sideline tonight. Bob, thanks for everything you do to make that possible. You see, standing on the sideline at a soccer game or sitting on the bleachers during a volleyball game is the best sign of pandemic recovery I have. That sense of normalcy is critical as our country recovers. Getting back to those experiences is not only critical for kids, but for our entire country. I don't have to tell this group, but never underestimate the power of athletics in the development of our youngsters. Your work is mission critical in education. Sports are such an important pillar of the education experience. They bring our communities together and teach students about some of life's most important lessons, like teamwork, persistence, humility, and overcoming adversity. Seeing games and seasons be canceled last year due to COVID-19 outbreaks was hard on our young people, and it broke our hearts to see the activities they love taken away from them. I was in Kansas recently, and I talked to a senior who missed out on her sophomore and junior season. She's a softball player. She says, I just hope I can get onto the field this year. I can't have my senior season taken away from me. She said, I want to go to college, and I know that I want people to look at me like my heart broke for this kid. That's what she wants. That's what we all want. We cannot have last year's or the year before repeated this year. And luckily, we're empowered with the resources and the tactics to make sure it doesn't. Our CDC guidance recommends proven strategies to keep players safe and prevent games from being canceled. Screening testing is an important tool that all teams can utilize to identify cases and stop outbreaks before they happen. They should be used by all. They can control quarantining tremendously. By far, the best protection we have are vaccines. A recent study showed that teens who are unvaccinated are 10 times more likely to be hospitalized for COVID-19 than teens who are vaccinated. So unvaccinated teens 10 times more likely to be hospitalized. If we send players into a football game without their helmet and pads, or a soccer game without their shin guards, if we wouldn't do that, why would we send them into competition without getting vaccinated? They also prevent games and seasons from being canceled. The NFL, SEC, and ACC know all about these risks because they saw how many games needed to be canceled or rescheduled last year. And they implemented rules that penalize teams with low vaccination rates. Teams know it too. Think of the North Carolina State baseball team who made a great run in the College World Series last spring on their way to winning the championship, only to have to pull out and forfeit after 14 of the 27 players on that team tested positive. K-12 leagues are starting to follow suit. The state of Hawaii, New York City, Fairfax County, Virginia, and many others are already requiring vaccinations as a conditions for athletes to participate in competition. This is in alignment with CDC recommendations and AMSSM, and I commend both of those groups for their leadership and commitment to student safety. What's right is not always popular, but as leaders, we have to make the tough decisions. After 18 hard months for our young people, the stakes are too high not to get vaccinated. Thank you again for all you do and for joining this conversation today. Thank you for being leaders in your community and champions for our students. I truly am really proud of your leadership, this group's leadership and sacrifice for our students. And we at the Department of Education are ready to support you because after all, we're on the same team. Thank you very much.
Dr. Cardona, thank you for being with us and for your encouraging remarks. One of the concerns that we have from the NFHS ecosystem, if you will, state associations working together with their local departments of health, their state education departments, and sometimes there's a little bit of tension there with what we want to do to protect our kids. There might be a little bit of a, sort of a political pushback. Do you have any advice for us, or what would you say to parents or players who might be on the fence about getting vaccinated, for schools that are working with their state agencies? From your office, do you have any guidance for us that we might be able to take back to our states?
Well, listen, first of all, our doors are always going to be open to you, Karissa, and to anybody. We want to make sure that we're sharing best practices from across the country. We want to make sure that you don't have to learn. We want you to learn from other people's mistakes when they did something and they realized they had to change course. We want to make those examples available to you. So know that we are as interested in this as we are in making sure that students have good reading strategies. This is that important. But what I will tell you, and from my experience as a commissioner of education in Connecticut before Secretary of Education, communication matters, and not just when there's crisis. So I would say having the lead person at each state have conversations regularly with the commissioner, with the governor. You have to be on the same page. You have to be very clear about where you're going and how athletics plays a role in this. Another thing, you know, I had a conversation with the chief doctor at the NCAA recently, and I said, you know, students listen to students best. So when you have the captain of the teams talking about it, or when you have, you know, a meeting and you have all your senior players talking to students saying, listen, this is my last shot here. It matters that as a team, we take care of one another. They're safe. There's no, you know, leave the drama out of it. This is about teams. And I think, you know, athletics know that best. You know, you get on a team and you're one. So it's really important that we frame this that way. You're helping your team out. Nobody wants to be that kid that has to have half the team quarantined because of them. So that's preventable now. And I would say use our student athletes. Student voice always matters, and students listen to students best. So if you haven't set something up like that yet, do that soon.
Thank you. Dr. Cardona, always wonderful to be with you. Safe travels to those games tonight.
Yes. Listen, thank you very much, Karissa. I appreciate what you're doing, and to everyone listening on this call. And this is a tough time. And, you know, we're not out of the woods yet. We're not out of the woods. But just like I said in my remarks, getting on that sideline and listening to those students on how happy they are to be on the field, that's a sign of recovery that I don't want to give up. Let's keep doing what's right to make sure that we never go back to how it was before. Thank you for your sacrifice. Thank you for your work. We're here to support you. Have a great day, everyone.
Thank you. All right, we are now strongly encouraged by the Secretary. Would love to now transition to hear from the Centers for Disease Control and Prevention. And we are grateful that Captain Albert Schatz has joined us. Captain Schatz, we would love to hear your perspective from the CDC around vaccination, ages 12 to 18, anything that you have to offer our audience today.
Great, thank you. I would just like to start and let everybody know that I'm bringing several perspectives to the conversation this morning. So I was a student athlete. I started diving when I was 10 years old. I tried out a couple other sports, but diving stuck for me. I dove through high school and also played water polo, and then I ended up as a Division I springboard and platform diver. So I also grew up in Texas, so I completely understand the sports culture and how important sports are to communities. And now I also coach. I coach diving at the local aquatic center down the street from us. I'd also like to say that I'm a mom. My son is 12 years old. He's in a local public school in person in 7th grade, and he's played baseball and is currently playing soccer. And aside from my personal life, I have a master's in public health, a PhD in epidemiology, and I started working in public health 19 years ago. And I started working for CDC in 2009, and I'm a commissioned officer in the US Public Health Service. I've been working on the COVID-19 pandemic since March of 2020. So this has been the primary thing I focused on since that point in time. So now that you know a little bit about me, I'll switch over to some data slides. Can't present from CDC without some data. So I will share my screen. There we go. Great, let me know if you can't see it, but I'd like to just present the most recent data that we have on pediatric burden and the severity of COVID-19 illness. And so for pediatric, it's anyone less than 18 years of age. So CDC really does work 24/7. I received these slides at 2 a.m. this morning from the data team that pulls together these data. And so I just want to start by showing a graph of the case counts. So this dotted line here that's in blue, those are the adults 18 years and older. So you can see throughout the pandemic, this dates back to July of last year. The peak has been among adults, and then you start to see a crossover here. And then the 12 to 17-year-olds are the highest peak that we're seeing right now in the pandemic, followed by the 5 to 11-year-olds, and then the 0 to 4 are still thankfully lower than adults, but we have seen an increase in the 0 to 4 as well. And so the lowest case counts that we had in the recent part of the pandemic were at the end of in May and at the end of June. I think June 20th was our lowest case count. So this was the increase that we experienced with Delta, but it's important to show that vaccination started to become available here in this March and April time period, and that's when you saw the transition of adults dropping below the pediatric ages, and then vaccine became available for pediatric populations, children and adolescents 12 to 15, right here around May 10th. So those are just the case counts. I also did want to present some quick data on hospitalizations. And so this is broken out by the states that have different levels of vaccination. So this figure here on the left are the 13 states that have the highest percentage of vaccination. This next section here are the states, 12 states that have the second highest vaccination rates. This third set is the second lowest. And then this here is the lowest vaccination rate on the far right. So you can really see that over time and with this Delta spike here, that the states that had the highest vaccination rates really did see a smaller number of pediatric cases. So these are just the children. And so what this tells us with these rate ratios is that children are most protected when they're in states that have highest vaccination rates. So you can see that the peak goes higher and higher as you have less vaccination. And so in summary, we know that our average daily rate of COVID-19 cases per 100,000 is higher among children and adolescents 5 to 11 and 12 to 17 than adults. So that was that case count figure that I showed. The rate of pediatric COVID-19 admissions is highest in regions 3, 4, and 6, which are down here on this map in the bottom right-hand corner. But those are for DC, Mid-Atlantic, Atlanta Southeast, and Dallas South Central areas. And we have seen the pediatric COVID-19 admissions highest in states with the lowest COVID-19 vaccination rates, which is that figure that I showed with the four graphs. For severity, we've seen Hispanic children accounting for the highest proportion of COVID-19 deaths among children and adolescents. And we've seen the highest death rate among Native Hawaiian and other Pacific Islander children and adolescents. It is important to point out that among children and adolescents with COVID-19 associated hospitalizations, so of the children and adolescents who are hospitalized during the Delta era, we've seen no substantial changes in ICU admission, mechanical ventilation, and death. So I like to explain this as we have more children and adolescents now with COVID-19, but the proportion of severe illness is not higher. So for instance, previously, say we had 10 children and adolescents with COVID-19, and one of them then was hospitalized. Now, if we have 100 children with COVID-19, we would expect 10 of those children to be hospitalized. So even though we're having a higher number of hospitalization, the proportion of severe illness and outcome is the same. So that is good news wrapped in bad news. And then I just want to quickly say, for prevention strategies, our school guidance is focused on in-person learning. So as a student athlete, one of my coaches always said, school, sports, social. So I think the same applies to CDC's guidance. We're focused on making sure that students can stay in in-person learning. And so our recommendations really are focused on in-person learning, and then hopefully sports and extracurricular activities can also occur and be protected. The number one recommendation is promoting vaccination. So all the things that have been said already just in this session are in full support of vaccination. One point that I would like to make is that currently fully vaccinated people, when they're exposed to someone with COVID-19, they don't have to quarantine at home. So our current recommendations are for a fully vaccinated person who's exposed to someone with COVID-19, that they get tested 3 to 5 days after that exposure and that they mask, of course. But if you're fully vaccinated, you don't have to quarantine at home, which means you can continue to participate in in-person learning as well as your extracurricular activities. So it not only prevents you from getting severely ill and having to be hospitalized or die, but it also supports in-person learning and participation in extracurricular activities. So vaccine is safe, it's effective, it helps support in-person learning as well as sports participation and extracurricular. Drama, choir, all of the extracurricular activities that our students love, it supports that. But I will say that all of the other prevention strategies are critical. We know everyone under 12 is not yet able to be vaccinated. And so having these layered prevention strategies are what we have seen through investigations and data, and that's what works. So I will stop there for now. I think there were a few questions. Chris, did you want me to answer those now or save them for later? Oh, sorry, Chris, you're muted.
Yeah, absolutely, Erin. If you'd like to jump right into the questions, that would be great.
So the first question I had was just about encouragement or requirement of vaccine. And I would say that mandates can be effective. And as they're being rolled out, the groups that are mandating them should identify and have a plan for the important considerations of requiring a mandate, such as equity and access to vaccine. I will say that vaccine is highly available throughout the country at local drugstores. So vaccine is highly available, it's free, it's safe, it's effective. And CDC is currently developing approaches to evaluate the impact of mandates and also help with implementation tools. The other question that I had was, is CDC concerned about the emergence of additional variants? And if so, are the variants anticipated to be more virulent? So of course, we are continuing to watch variants, not only here in the United States, but throughout the world. So we collaborate with the World Health Organization, with states. Really, this is a pandemic because it is worldwide. And so the recommendations that we make are based not only on CDC data, but data and studies throughout the entire world. And so I did want to show just so for people that were specifically interested in variants, that CDC has several pages on variants. It describes the different variants, how they're different, how they're determined. And we have this page here that shows the variant proportions in the United States. It's loading because it has real-time data behind it. But as it's loading and the colors improve, this section here is the Delta variant. There it goes. And so this section here is the Delta variant. So you can see back on June 12, 2021, this was the proportion of Delta variant that we had, and then this was B117. So you can see over time how the Delta variant really took over and became the primary variant of the SARS-CoV-2 virus that we see in the United States. And then if you scroll down on this page, it will show you by health region what the proportions of the different variants are. So if and when there is another variant introduced into the United States, we watch it. We do what's called genomic sequencing to see what the variants are of current COVID-19 cases. And this is where we map it and make it available to the public. So I just wanted everyone to know that this resource is available online. And if there is follow-up from this, we can share the links so that people can easily find it. Let me stop my share. And then the last question that I had from the membership was, what are CDC's concerns if young people do not get vaccinated? So I think everyone on the panel has already talked about how important, how safe vaccine is for youth and adolescents. And so for us at CDC, we are focused on preventing illness and death from all illnesses, all public health problems. And so with how safe vaccine has been, how how many millions of people have gotten it and how we've seen it work to prevent people from being hospitalized, our concern is that a very effective prevention strategy is not put in place. So we all have family members as well. And so we just want everyone to be as safe as possible. Thank you, Chris.
Erin, thank you. Is all of this information available, just CDC website? And I know there are tons of resources there, but if we have further questions, can we find our answers likely right on that CDC website?
Yes, it helps to know the keywords because we have so much information, but CDC's COVID tracker, that is a data visualization piece where all of the data are. That's where the variant data that I showed, it also shows levels of community transmission, cases by age group. So you could probably spend days there looking at all the data, but CDC COVID tracker, that is where the data live.
Thank you. Really appreciate your time today and your expertise, and know about the diving connections. So would love to talk to you to see if you know a good friend, Cynthia Potter, who's from the Houston area.
Yes.
All right, super. Thank you, Erin, for being here, and best of luck to you and your children as they pursue their careers. At this point, we are very, very lucky to have two doctors with us this morning. Dr. Cameron Wolfe from Duke. Dr. Wolfe is the chair of the ACC's COVID-19 Advisory Group and is an infectious disease physician, as well as Dr. Robbie Sika, chair of the Sports and Society Work Group, who works closely with pro and collegiate sport leagues on COVID issues and protocols, and most recently served as the Vice President of Basketball Operations and Wellness for the Minnesota Timberwolves. So Drs. Wolfe and Sika, thank you for being here. We welcome any thoughts that you have for us.
Thanks so much for having us. I'm going to pull up some slides here. Thank you for inviting us, Karissa, and thank you to the White House and the CDC. And it's always good to be connected to folks from AMSSM who've been great leaders here as well. So I'm Dr. Sika. I'm with the COVID Sports and Society Work Group and COVID Collaborative, and Dr. Wolfe is going to join here in a second. We've put together some data since we've worked with college sports and pro sports where vaccine mandates have been useful, and it's important to consider some of the data that we've been able to derive from pro and college sports. So let's start with sports and vaccine mandates and what we've seen across the Power 5 conferences. So across the Autonomy 5 conferences, more than 90% of student athletes are vaccinated, and that's a much higher percentage than the broader population of age-matched individuals. Of the 69 schools in the Autonomy 5 conferences, more than half have issued vaccine mandates, and more than 30 schools are over 95% vaccinated across all student athletes. Across the ACC, and I know Dr. Wolfe will go through this, more than 7 schools are currently using vaccine mandates. 10 schools in the Pac-12 have vaccine mandates. And across professional leagues, you can see the striking number of professional athletes that have been vaccinated. This is a very large proportion, and it recognizes the incentives that professional athletes have. But if we separate this out and look at the incentives that youth athletes have, youth athletes want to play as much as professional athletes. In some ways, it's even more important because they have a certain amount of time that they're going to be able to participate. Vaccine mandates have allowed organizations to move forward despite cases. And as Erin just alluded to, you don't have to contact trace out an athlete if they're vaccinated. And I think that that's a really important message here, that there are strategies to allow you to continue to play with minimal disruptions for your athletes. And to speak to the granular level of what we've seen with professional athletes and collegiate athletes, vaccinated players return faster than unvaccinated players. That's on average, but it's important to remember this because in the NBA, we had a player who had COVID, who was vaccinated, who was able to return for the NBA finals, and he probably would not have been able to return had he not been vaccinated. So if you want a strategy for a player to be able to return, getting vaccinated is your best strategy to have your player return in season. These are examples of schools that have over 90% of their student athletes vaccinated, and I frankly ran out of space on the slide. mean, these are schools that are all over the country, representing every conference across the Autonomy 5. And like I said, we ran out of space for some of the SEC schools, but just know that there's SEC schools that are right in the key parts of the country where we've had a ton of COVID. And these schools have been able to get over 90%, like the University of Georgia football team, and be able to continue to play despite having cases. So the best way to minimize disruption is to get over 90%. But 90% isn't perfect, and it's important to remember why vaccine mandates have worked. They reduce the vulnerable population to near zero, and it allows for a significant reduction in potential spread. We know that unvaccinated individuals shed more virus for longer and have higher R0s, so they spread more virus to individuals. Breakthrough cases may happen, but they result in even less spread, even at the same viral loads. So despite what we've seen in the media, it's important to note that vaccinated individuals spread less virus. They spread less virus and are less contagious. So your best way to have the healthiest possible team is to have more people get vaccinated. If vaccinated based on the current guidelines, you can test your athletes. You have access to testing now, and you would be able to continue to move forward with minimal disruption, which in a population of youth athletes is probably even better because these athletes may be prone to injury from stopping and starting. So if you're pulling an athlete here and there and you're predisposing them to ACL injuries or hamstring injuries because their practices are not consistent because of COVID, I think that's an incredibly important message for the state high school leagues to recognize. In the absence of a pandemic, your primary focus was to make sports as safe and healthy as possible for athletes to be able to participate. This goes hand in hand with all of the things that you've done to reduce concussions, to reduce ACLs, to reduce all of the other injuries. This is the same concept, just being looked at from a slightly different lens. It allows for continued participation, and most importantly, allows you to layer in other mitigation measures. Because if you do have a case, similar to what we're going to see in the NFL this week with the New Orleans Saints, similar to what we've seen in the NBA when we've had outbreaks in the conference finals, you move forward. You move forward and you don't have to pull out all of your teammates because you are fully vaccinated. Those concepts are incredibly important. And I'll let Dr. Wolf share a little bit more here about some of the collegiate data that we've been able to collect across all of the conferences.
Yeah, thanks so much, Robbie, and I appreciate the chance to join here too. I'm a dad of two kids who are coming through school sports myself, so it feels close to home. Even though my college experience, as you can tell from my accent, was in cricket, not these sports we're talking about today. Look, your comment there on your comment on the need, on the desire to keep people healthy in a way that for COVID has sort of felt the same for us as what we've done in terms of keeping athletes healthy for head injury and concussion and musculoskeletal injury is exactly how we've tried to model it here. I don't think we had perfect understanding of all the implications of COVID to a young athlete 18 months ago. And so we've built many of our protocols around that. I still think we're learning how that has played out. So what, we've tried hard, I guess, to really drive all of our teams well over the 90% mark that was described. We're not there in every team, but we're a hell of a lot closer than we were previously, and much of that is in fact due to vaccine requirements. But it's worth us, I think, commenting briefly on the fact that even if you get up into those high numbers of sort of 70, 80, 90, it's still very clear to us from this year's experience already that it only takes a couple of individuals who, in fact, are not vaccinated within that team to pose much more disproportionate risks to the team dynamics than you would expect from just the proportion unvaccinated. And so, to Robbie's point earlier, what we have seen is that unvaccinated individuals shed for longer. We've seen with Delta that this has been more transmissible. And so the dynamics of trying to figure that out within a team is just that much more complicated if you certainly if you're below 90%, but even sort of 90 and above it's tricky. So we know the vaccines aren't perfect. We've had some breakthrough cases as are well publicized, but they are decidedly uncommon. They're brief, and even when I take a vaccinated individual, and as Robbie said, then think about, hey, I've had a positive in a team, how do I trace? That vaccinated individual keeps playing. So we have not had the sort of difficulties with teams missing games consistently, like we had last year. All of our teams so far in the ACC have been able to move on and continue to play, where many of those situations would have had them pulled from the game through health departments or contact tracing this time last year. So there probably are differences across the country as to how this plays out. Certainly if you're in New England at the moment where the overall transmission rates are still less, it may be a little less relevant for you right now than it would be if you're in Texas or Florida, but we've seen those waves sort of move through the country sort of fairly progressively. And so I don't think we should sit on our laurels really, depending on whichever part of the country we're in. You can move forward, Robert. The secretary took my thunder a little bit with our NC State example, but I don't want to underemphasize how tragic this was for this kid. This hit them like a train, because despite very good mitigation processes that we had in place, their level of vaccination mixed with Delta. So this was happening in June. And so if you think back to those CDC curves of variants that you saw, June was just as Delta began to really peak, and we did not appreciate that so much at the time. This led to so many other people having to be quarantined on that team that they could not continue to play. And that had ramifications well beyond their individual chance to win that tournament. We shouldn't underestimate the psychological impact that had for those kids. That had ramifications on their coaching staff and administrators, who themselves were probably higher risk, frankly, than their student athletes in terms of COVID complications. That had issues for the town and the area where they've played their sport, both in Omaha and then also coming back here to North Carolina. And I think, that's the other part of this that maybe we haven't touched on quite so much, is that we very much see ourselves as not only setting a good example for the rest of our community as to how to manage COVID and move forward with COVID and participate in the presence of COVID safely, but we do not want to be the vector for which our community gets sick. And I am very sensitive to not only setting a good example, but not being a transmission point because of the way our schools, both college and frankly high schools and middle schools, move. Robert, you can move forward. So some of this has been discussed, but it's worthy just to keep going. The consistency for our athletes shouldn't be underestimated. Last year, we all had athletes who were pulled for sort of 14-day quarantine periods where they weren't training. They weren't doing the consistent, safe, injury-avoiding practices that we know we should be doing. Their reintroduction to fitness techniques slowed them down, and I'm sure we had extra problems as a result, not to mention simply performance. Athletes are at unique risk because of their travel. Some of Robbie's players, some of my players have maybe some unique travel advantages that are not present in every high school or middle school team movement. But when you move a team together, you're moving a team in close proximity. It's intimate. It's an intense exposure risk, which I think we need to sort of rank a bit higher in our minds. It's not just the on-field transmission. In fact, we almost saw none of that. It's everything that happens around the team dynamics. It's what happens when they go to the locker rooms. It's how they move in their bus or their plane or their car. It's what do they do in their meal sessions together. All of that stuff is intensely intimate. Someone mentioned earlier the variability, I think, in team sizes, and some teams higher risk than others. I've really tried for our group to move away from that, because I think even if I'm dealing with a 10-person tennis team, for example, if I have two of those guys who get sick, the implications for that small team can pull them out of their game just as quick as if I get two on the larger football team. We shouldn't be talking about vaccination and think that the rest of the mitigation efforts can simply go away. We've seen that masking remains important. Thinking about our distancing dynamics remains important. But it is so much harder to make athletics move forward without vaccination of that central tenet. You can do all the mitigation in the world without vaccination. I think Delta has proven we get in trouble. And someone mentioned earlier long COVID, and we're still learning about that. If I could sit here and have perfect data in front of us as to how that played out, I think I'd feel much more reassured, but I do not know. So I sit in front of my athletes and say, if you're left with even a 5% drop off in your performance over the next couple of months, that can have really damaging effects to that person's playing, that person's moving forward, that team's effort if it's a key player. I don't think we should underestimate what that does. We've seen college athletes for sure have their season derailed because of long COVID, even when the actual illness itself was quite mild, without going into individual.
I just want to add 2 points on that. We are continuing to look at long COVID in pro athletes and college athletes. These are going to be ongoing research projects that I know are supported by many of the other folks on these calls. We'll share all those findings with you, and I know that they're important, but the reality is we have seen many pro athletes, and it's not 20%, but it's a percentage. And these are athletes who have real effects who are unable to return. The second thing, and I say this as a parent as well, as I know Dr. Wolf and Dr. Sauerschatz mentioned that they're parents too. This is a virus that points a finger in a unique way, and getting vaccination covers your team in a unique way, because if someone gets COVID and they pass it along, there is a social consequence that has an impact on your team and the psychological effects. I've seen it in the NBA where one player blamed another player for exposing him, and this was pre-vaccine. When you have unvaccinated players, that risk is so much higher that those social effects can really, really damage kids. When you level the playing field by vaccinating everyone, you allow sports to continue in their most natural state. This is a respiratory virus. You're going to have cases, but you protect your kids and you protect the student athletes in such a better way that you allow them to have the best psychological setting for them to enjoy their sport and enjoy something that should be pure and innocent.
That stigmatization really played out for NC State in a public way. It was awful for those kids. And if I could avoid that again, I would do it in a heartbeat every time.
Thanks. I think we're done. But if there's questions, I do want to offer, if there's pro and college sports that can help with PSAs, but I think we've moved beyond the PSA stage at this point in many ways. But whatever, I know Dr. Wolf and myself, whatever we can do to connect those organizations that need a boost from pro athletes or college athletes, we're happy to help in any way.
Dr. Wolf, Dr. Sickett, thank you so much. I know this was a quick grab of your time this morning, and we truly appreciate your medical expertise, the reflections on the teams and the athletes with whom you've worked. Really appreciate the message there and the example. Thank you for being with us this morning. We're going to move as our time is fast approaching our hard stop at 9:30. We are very, very privileged to have with us this morning some peers from schools on the ground. We have the Superintendent of Schools from Fairfax County Public Schools in Virginia, Dr. Scott Brabrand. Fairfax County, as you may know, is the 11th largest school district in the U.S. We have almost 200 schools and centers and almost 200,000 students with 24,000 employees. That's a big job. We also have representatives from Anacostia Senior High School in the DC area. Michael Reed, their athletic director, Jason Lane, their head football coach, and Reginald Walker, senior, the head girls basketball coach. So Dr. Brabrand, perhaps we'll start with you. Welcome, thank you for being here. What would you like to share with us from Fairfax County Public Schools?
Sure, I'll be super quick. First of all, Chris, thanks for inviting me. What a wonderful, it's so energizing on a Friday morning to hear this group. And my biggest point maybe to you is this message needs to go national. Our national leaders and policymakers need to call for mandatory vaccination for all athletes now, right now. This is a no-brainer. It preserves the instructional integrity of our students, and it preserves the athletic integrity of our athletes and our athletic programs. We've returned to school, but athletic vaccination lets us preserve returning to school. And it is the biggest no-brainer that I can share with you. We announced it 2 weeks ago. 10 more Virginia districts have announced in the last 2 weeks. It is a momentum that is gaining ground across the country. And I think it is time, as Dr. Sika, Dr. Wolf said, going beyond PSAs. I would love to see our national leadership and our national athletic leadership call for national vaccination of all student athletes, frankly, K to 12 and in college. I've had very few in a county of 1 million people, maybe 5 emails expressing concern. Everybody else sees this as a huge no-brainer. So thank you very much for inviting me today. I'm 100% behind this, and our vaccination is the way out of this pandemic. It preserves instructional integrity for our students and the integrity of our athletic program for our athletes. Thank you very much, Chris.
Dr. Brabrand, one of the questions that came up in the chat that was earlier was about access for perhaps underprivileged. You have a huge district. You've got diversity in your district. What was access like? How quickly can we get all these kids vaccinated, and how did you do that logistically?
So one thing we've done is school clinics. Over 80% of our 12 to 17-year-olds already have their first dose. We did school clinics right before school ended in June. We're going to continue to do those as we move forward. Strategically, we've worked closely with our health department. To be honest, I think as we look at the elementary kids, we're going to look at doing even more school clinics. We're going to look at mass vaccination community clinics with the state of Virginia, the Commonwealth of Virginia, through the Virginia Department of Health. And we've gotten the message out that vaccination is a key mitigation strategy, and our community has responded. So that's part of it. And I think people want to play, as the doctor said. People want to see their kids play sports. They've been not having the opportunity. In Virginia, we had a shrunken sports season last year. People are back. Our attendance at sports is way up. People are excited to see their kids back on the field, and this vaccination mandate preserves this opportunity for kids, for their parents, for our entire community.
Thank you. Dr. Brabrand, thank you so much for taking the time. You have just a few things going on there in your district. Really appreciate you being with us this morning, and I wish you a happy Friday and a good weekend.
And Chris, honestly, anything I can do to get you or the team to have a national press conference to say this, I'm ready to take the microphone, and I think many others are around the country. It's got to happen. It's got to happen if we're going to keep our kids in school and our kids playing sports. Thank you.
Thank you. We will be reaching out. Finally, on our panel this morning, we have representatives from Anacostia Senior High School in the DC area. Michael Reed, Jason Lane, Reginald Walker Sr. I'm not sure who would like to take the mic first, but what's going on at your school? Tell us your perspective from boots on the ground.
Good morning, everyone. I'm Michael Reed, Athletic Director at Anacostia Senior High School. Thanks for having us. Right now, we're doing like everyone else is, making sure that we're getting information to our student athletes and their families. I will say,
I think you might be frozen
has
there.
done a great job of making sure that Concord has done a great job of, providing that sites for our community to get. Are you able to hear me?
Yes, now. Yep.
Okay. So what I was saying, I'm not sure what you call, but I was just saying that our school is doing a great job of, I would say, the mayor as well as our athletic department. The DCIAA is doing a great job of communicating and getting the information that we're being able to, give out to our families and our student athletes. We do have sites at our school as well as in the community to be able to help these student athletes as well as their families to be able to get vaccinated. So I was saying that we're doing just like everyone else, promoting, our kids to get vaccinated so we can keep them inside of the classroom, but also being able to have the opportunity to be able to be, on the playing field.
Fantastic. Jason, Reggie, as coaches, how's that been for you?
For me as a coach, it's a constant reminder to the young ladies that we must practice the CDC guidelines, especially in protocols when we're in the locker room, making sure that we wipe down our equipment after every workout, that we even wipe down our lockers and everything to make sure so that we can stay safe and healthy, so that we can have a season that we missed out on.
Jason, if we have you, obviously you're coach of a sport that is often very much centered in the media, football. One of those sports that when we came out with this was considered high risk. How has that been for you as a football coach?
And Chris, I don't see Jason on right now. I think he had to jump off. Mr. Reed, did you want to say something on his behalf?
Yeah, I would say the football team for Coach Lane, they've been doing a great job as well, trying to, get our kids acclimated to everything that's going on, because it's all new to them. The season is here. Of course, again, we're still trying to get all of our kids vaccinated, and the importance of how it will affect. I know someone had mentioned earlier about the social piece. I think that the kids, they look for that to be able to be amongst their teammates and everything. So I feel like that plays a huge part. So, and someone mentioned earlier in the conference stating about having that senior leadership of, the team, of just being able to have that student athlete to speak on the importance of getting vaccinated. I think that definitely goes a long way as well.
Well, thank you, gentlemen, for being here. We are at our planned stop time, a couple minutes over. I think to summarize this is, first of all, thank you. On behalf of the NFHS membership, the athletic directors and coaches across the country, and anybody else that may have dialed in this. This recording is something that we will make available through our website. If any of you want to access it, please just let us know. To have leadership from the Secretary of Education to the CDC, Dr. Schatz, from individual physicians, from the AMSSM, all together is powerful. And we've never had that opportunity to be able to have an hour together and really hear from the leadership at the federal level about why something matters. And in this case, it's vaccine. Keep our kids engaged in school, to keep our kids engaged in sport. We certainly learned when kids were disengaged how important our activities are. We saw that through mental health studies. We saw that through stories about disengagement, lack of fitness, lack of activity, and lack of growth and development that, quite frankly, we can't get that back. So lost time, lost growth. So I think this has been a powerful gathering this morning. It's a powerful message. If what I hear from our expert panelists is that they are there in support. There are plenty of resources on the CDC website. And from our high school ecosystem family, we thank you so much for gathering this morning to share your time, your expertise, and your willingness to help us move forward. And for those, Dr. Brabrand, from Anacostia representatives, thank you for being with us to tell us that you're making it happen and it can be done. So with that said, if there are questions in the chat, we will capture those, perhaps reach out to our experts for some more substantive answers than perhaps we can provide at the NFHS. And again, we'll make this webinar available to our membership, and can't express enough gratitude for the time that you took to be with us. So I hope you all have a great Friday, a great weekend, and of course, I hope you all remain well. So thank you again, and we will stay in touch.